Good afternoon, and welcome to Cloud ERP as a recipe for IT cost containment and value realization, a webinar tweet chat combo from healthsystemCIO.com, sponsored by Workday. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of healthsystemCIO.com, and I will be your moderator today. We are having a simultaneous tweet chat hosted by Kate Gamble, our managing editor and director of social media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can simply view the tweet chat in the media viewer panel on the right-hand side of your screen. We'll also be using the Q&A panel today. You can send in your questions as they occur to you and leave the default set to all panelists. We'll take those later in the program. And you can download the deck by using the URL on your screen, and it's also being sent out in the chat box. Just so you see how we're going to spend our time today, first we're going to go about 35 minutes with our main panel discussion featuring Chris Ghion, VP and CIO at Adventist Healthcare, J.D. Whitlock, CIO at Dayton Children's Hospital, and Win Fisher, Healthcare Supply Chain Advisor with Workday. So let's jump right in. Chris, you want to give us an overview of your organization and your role?
Sure. At Adventist Healthcare, we are a full continuum of care hospital. We have acute care hospitals, behavioral health hospital, rehabilitation hospital, and a home health organization. We also have outpatient services focused on urgent care and imaging are our primary focus. In a IT perspective, we're a shared service model, so my job is to support the IT function for all of the entities and hospitals that I listed across our system. And in that context, I am also part of the senior executive team as the IT representative.
Very good. Thank you. J.D.?
Hello, J.D. Whitlock. The Dayton Children's is a small to medium-sized integrated delivery network in southwest Ohio. One bedded facility, another large ambulatory facility, and then a handful of outlying facilities. And we serve a large area, a mix of areas.
Okay, very good. Win?
Yeah, thanks, Anthony. So Workday is a multi-tenant SaaS provider of ERP technology, founded in 2005, and we have over 145 healthcare customers that span the continuum of care from ambulatory to post-acute healthcare providers. And the whole idea about Workday is being able to plan, transact, and analyze all in the same system. At Workday, I help lead our go-to-market strategy for North America, so working with prospects and customers alike to better understand our supply chain offerings. So looking forward to the call today.
Very good. Very good. All right, let's jump right in. JD, let's start with you. What was the catalyst for moving your ERP to the cloud? And was the decision influenced by the industry's overall shift to value-based care or any other trends?
So our move, the catalyst for our move was that our previous human capital management system was SendStudy, McKesson and HBOC. So we were a combination of paper and green screen. So we needed a modern healthcare ERP. Was it influenced by industry trends in that we knew we wanted a healthcare ERP? Well, yes. I mean, most healthcare organizations do that. Was it specifically influenced by value-based care? Probably not necessarily, no. So really that's what drove it. And I don't know how much detail you want to hear about the selection process and all that, but that's the short answer.
I think we'll get into that. So that's good for now. Chris?
Sure. So our catalyst, we spent probably similar to other healthcare organizations a number of years investing in our EMR at the expense of other systems, and our ERP platform, which was based in PeopleSoft, but not only a PeopleSoft system, was a number of years old. We did not go through traditional upgrades, and we were basically working off of a PeopleSoft system that was a few versions behind. Our decision was based on modernizing our entire technology platform, and the ERP platform was the first piece of doing that after the EMR. That was the primary decision as to our influence. It was one of the first things system-wide on our strategic plan coming out of meaningful use investments in the EMR. In the context of value-based care, we think the data coming out of the system combined with other sets of data will help, but that was not the primary driver in moving our ERP to a new platform and into the cloud.
All right, very good. Okay, Chris, let's go with you first here. What factors did you consider when selecting your provider?
So the main factor is we made an organizational decision to streamline as much workflow as we could across human capital management, finance, and supply chain, regardless of which product we picked. That was our main factor. Once we decided that really drove our the strategy for our RFP process. And what we found is the Workday product, from a technical perspective, matched very well to that business strategic directive that I just spoke to. So that was the primary factor. A secondary factor specific to technology is we've made a decision that we wanted to move our technology platform and quickly and advance it to both leading edge and mid edge technologies. And we felt after a good year's worth of analysis that Workday really was the market leader for an integrated ERP platform. We felt that from a cloud perspective, and I think some other questions later will get to that, but from a pure technology perspective, the way that Workday is architected and the way they handle upgrades really fit into our methodology of moving forward in kind of a real-time environment there. And those were the primary drivers. We also looked at as kind of a secondary driver where we saw the support model for Workday for ERP platforms moving forward. So we saw a lot of other companies standing up to provide Workday type services around consulting, implementation, support at the expense of some other products. And we felt, stepping back and looking at all three of those things, we were investing in a platform that was a market leader and that was positioned to be a market leader for many years to come.
Very good. JD?
So a lot of similar things to what Chris said, so I won't repeat them all. But one thing worth mentioning was because we were not starting from Oracle or Infor on-prem, we didn't have any sort of incumbent for their cloud products, any favoritism there. But beyond that, pretty much the same things that Chris said.
All right, very good. Wynn, let me ask you, what do you think people should consider when selecting their cloud provider? What are some of the things that should be on their checklist to evaluate?
Yeah, I think it's a good question. So first and foremost, obviously want to understand the healthcare or the providers, the ERP providers' investment in the healthcare industry. Because whether it's HR, financials, or supply chain, it's healthcare-specific functionality that you need to be able to deliver today and then deliver through value over the long term and into the future. And then really the other one that I think that providers should focus on is the business partnership because you're making a decision for a relatively long period of time, right, whether that's several years or even a decade's worth of time. So you need to understand how does that company partner with its customers to make sure, number one, that they're successful, and then number two, that they're realizing value over the long term of using the product. So whether that's like JD alluded to with the update cycles, so whether we're continuously delivering value over time or whether we're laser focused on customer satisfaction with industry-leading 98% satisfaction rate, those are the things that you should focus on when you're selecting an ERP system. So good question, Anthony. Thanks.
Very good. All right, JD, let's start with you. Can you talk a little bit about the contracting process? Are there specific contracting issues to keep in mind when selecting a cloud provider that people who are used to just contracting for maybe on-prem stuff don't think about?
So definitely the answer is yes. It's very different, needs to be thought about differently. I just happened to see a really excellent presentation on this last week at the Gartner IT Expo conference. And so for those that are listening that are Gartner customers, I'm going to give you a name of the analyst's name. Her name is Jo Liverzedge. I'll spell that J-O and then Liversidge. And so if you have access to Gartner content, she has some notes on very specific things to keep in mind for SaaS contracting. And some of them were sort of common sense that hopefully any CIO would know to think about, and about half of them were things that I was thinking to myself, wow, you're right, you need to think about those things, but those were not my list of things to think about. So basically go listen to smart people that know a lot about this and make yourself a list.
I like that. That's always good advice, right?
Yeah.
Chris?
Yeah, I think I'm familiar with that, and I'd agree there's points in there that we were not thinking about and were definitely some areas of consideration that will help. A couple specific things that we took into account. So once you move to a subscription-based model, at least for us, given our capital and operating cost footprint, you're really tied to your vendor. So the contract that you sign you need to think of it in the context of the current contract, however many years, and the future contract, the next contract. And you need to put language in the contract to price protect yourself for increases that may come onto the contract. Because once you're in it, you kind of lose that advantage of a new negotiation. So one thing that we did was almost conduct the current contract negotiation with links into the next one to make sure that we had a cost stream that we were comfortable with for many years down the road. One other thing, not specific to the ERP tool selection, but just as important for us, was we ran a parallel contract with an implementation services provider. So we had at the same time 4 ERP contracts running, and we are a statement of work, and for us it was Oracle, Infor, Workday, and Premier. And then we also ran a simultaneous procurement with implementation services providers, and we started with the ERP one and the implementation services provider one staggered. So the reason why that's important is because once you have your implementation services provider selected and your ERP selected, there's a process you need to go through that was very helpful to us in ensuring that a consistent delivery model for our stand-up was executed. So we were able to streamline milestones and points of engagement across both our implementation services provider and Workday. And we essentially brought both companies together and jointly constructed the 2 contracts to get us stood up and operational. And that was very helpful.
And this is JD. Let me talk on something else. That's a really important point for the implementer. And this is really different than so a lot of your CIOs are used to HR vendor. You're doing a big upgrade.
JD,
Yep.
can you say that again, JD? You cut out a little bit. Can you just repeat what you just said?
Sure. Let me go to headset here. So the implementation partner is super critical here, even more so than the slew of partners we normally use, like for an EHR implementation, where you're working primarily with your EHR vendor, and then you typically have some some go live support from a whole ecosystem of vendors that supply you people. In the case of a big ERP implementation, you are really probably more reliant on the implementer than you are for the EHR implementation. And choosing the right one is really critical. And actually, some of the challenges that we had with the initial implementation were some challenges with the implementer, not with the software. So that's super critical.
All right. Thanks for offering that. Very good. All right. Next question, Chris. We're going to start with you. Were the results of moving to the cloud those you had expected?
Yeah, so far they have been, and we're relatively early in the process. We went live July 9th of this year at one time with human capital management, finance, and supply chain, and we did all of that in 1 year. So in preparing for that, that was looked at in our research as a big risk, because the majority of customers we talked to had incremental go lives of the various modules, HCM, finance, and supply chain. We felt it was better for us to go live all at once for a number of reasons. I alluded to the centralization business model that we talked about business-wise, and then technically we did not want to invest in throwaway integrations that we would eventually throw away if we moved forward in an iterative fashion. We also didn't want to stretch out an implementation vendor's costs over a number of years. So we were very concerned throughout the project on a smooth go live and ensuring that our business was able to function, obviously, post go live, and that played out very well. We had some hiccups around invoicing, but we were able to overcome those, and that went well. The other big thing that we really were banking on with Workday is Workday really sold us on the fact that their upgrades are every 6 months, and from a resource perspective, they're not that intensive in terms of my team testing. And that's very different in my world than an EMR vendor, in other words, we're doing 9-10 month long platform upgrades. So we went live in July. I think in September was the upgrade to the next Workday platform that all their clients went on, and it was seamless. It went just as advertised, and all of the research that we did played out to work as advertised. So in a nutshell, all of the results that we used as strategic drivers of moving forward and tactical areas of concern, the strategic ones played out, and we were able to mitigate the tactical issues being a quarter in.
Excellent. Very good. JD?
So our move was less about moving to the cloud and just moving to a modern ERP. So we went live on the HCM, payroll, and finance in January of this year, and we elected to not move forward with supply chain at the time because supply chain was still, Workday was still maturing its supply chain healthcare offering, and so we just kicked off that project, and we'll be going live with supply chain next April. So the go lives were successful. We had, of course, any big implementation is going to have some challenges, and so we are now going back and looking at some of our processes and where do we still have some outlined manual processes that need to be automated, where did we perhaps not get things right on the user end to make things as customer friendly as possible for the users, and how can we do appropriate governance across the organization to make sure that all departments get a say in how our business processes are being managed. We're still working through some getting things right on reporting. We're looking at some of the Gartner guidance on what they call postmodern ERP and what should all those integrations look like, and how can you take advantage of the cloud architecture to make all that easier. And to Chris's point about the twice-a-year updates from Workday, it's much less effort than what we all typically go through for our EHR upgrades, but our challenge is we have to still make sure that we factor that in. It's still some work for testing, and we have to, in all of our governance work, we have to make sure that we are doing a good job with, first of all, taking advantage of the new functionality and making sure that the testing gets done.
All right, very good. Next question. This is actually for both of you. Chris, you work at a 4-hospital health system. JD, it's a children's hospital and health system. Can you talk about how the specific environment you're in related to your contributed to your decision to move ERP to the cloud? Chris?
Sure. So in our system, as I mentioned, we have a strategic vision of moving forward at I'm going to call it an Adventist healthcare organizational level, rather than look at all of our entities and hospitals as independent organizations. So that change of philosophy is playing out in many different areas. In the context of system support, what that has caused us to do strategically is to consolidate as many platforms as possible into what I'm just going to term our core computing platforms. An example, Cerner is our core EMR for inpatient, and Workday is our core platform. So that environment and that strategic direction helped us make the decision to consolidate to as many market leader vendors as we can. So that was step one. Step two, specifically moving ERP to the cloud. My philosophy for our team is with these technologies, the underlying infrastructure is best managed by the developers of the technology. And in that context, if you have that approach, then you're either looking at a remote hosted model or a cloud model. And with that strategic driver of kind of letting the experts manage the infrastructure, that is what pushed us really to the cloud, specifically with Workday, since they're a cloud-based platform.
Chris, give me a little definition here. Help me understand. I'm not that technically savvy. Remote hosted versus cloud model. How are they different?
So I think you would get a number of different answers based upon different experiences. From my experience, there's differences in contracting that you have, the formal contracts that you sign. As an example, with a remote hosted vendor, you need to, like Cerner, you need to negotiate if in a disaster recovery, what number do I come back at as opposed to every other client, right? So that's one tactical example. If Cerner has 300 clients, I don't want to be the 300th client coming back live after a disaster, right? So those kind of things map to remote hosted, where you get your own infrastructure in a organization, in this example, Cerner's data center. So the way that we've experienced it is remote hosted means our own private infrastructure hosted by a technology company in their data center. The cloud-based model, is all of the customers are on the same architecture, and things are segmented. And I don't know the specific details of very tactically how the technology behind the segmentation down to the memory allocation stuff works. But for all intents and purposes, the same platform hosts all of the customers, and in that context, you are one of many where the same thing happens to all of you at the same time. So that's how, at a high level, I differentiate it, and it really comes out in the contracting process of the levers that you have to push for each one of those. They're different negotiation strategies, whether you're remote hosted or in the cloud.
JD, I'd love to hear your thoughts on this discussion about remote hosted versus cloud definitions and the importance of, being on the same page, right? Everyone, the people you're talking to, you have to be on the same page with them. Everybody's got to understand what we mean when we use a particular term. So what are your thoughts on what Chris was saying and your understanding of these definitions?
Sure. So unlike Chris, we are not doing remote hosting for our EHR because we do have one bed of facility. We got a data center that sits right next to it. Nobody's going to come along with a backhoe and take out our connection. And so we are not planning on putting our Epic EHR in the cloud or remote hosted anytime soon. For the ERP, it just made a lot of sense for us. You asked about the specifics of Dayton to Children's. On the EHR side, there's a whole pediatric community that has to worry about the differences clinically with taking care of kids instead of adults. An ERP world, that doesn't really matter, that we're pediatric instead of adult. What does matter is that we're relatively small. And so my previous gig was with a large adult system, 20 hospital, who, by the way, is also moving to Workday. And, the scale of resources is just very different. So how can we capitalize on and take all the advantages of a modern ERP moving forward with this relatively small team that we have? It's a challenge for the reason there's, so much consolidation these days in healthcare. Is just really hard for smaller healthcare providers to do all the things that you need to do. And so having a cloud ERP is just, one less thing to worry about for us internally, for the IT staff.
Very good. Wayne, I'd like your thoughts on our discussion of remote hosted versus cloud.
Yeah, I think that, and Chris and JD hit on it, but maybe I'll just add a couple thoughts. I think at the end of the day, it's all about value through scale, whether that's collaboration value, so I can collaborate on a much larger scale, because if I'm on the community boards like Workday Community, or maybe I'm at a user conference, it's not trying to figure out what version of the software my peers are on, so then I can figure out a smaller group to collaborate with. From a collaboration perspective, you have a much broader base to bounce ideas off of and to improve, off of. From a product and innovation perspective, everyone is realizing the value of innovation that is built for the product. So whether it's a brainstorm that Adventist puts in, that then Dayton Children's can realize the value from, everyone is on the same system in a multi-tenant and a cloud, true cloud software, so you realize that value from a product perspective. And the last one is things like benchmarking, really unprecedented areas that the healthcare industry is moving into. When you have everyone on that same data model, you can then de-identify that data and leverage benchmarking, whether it's by industry, whether it's by, as JD alluded to, size of the hospital. You can segment that data and then benchmark yourself against your peers if everybody is on the same data model and the same version of the software. So at the end of the day, it's value through scale.
Very good. All right. Wynn, let's stick with you on this. Let's talk about security of moving to the cloud. Many say it's improved, but some are concerned that there are security issues. What would you want to tell the folks out there thinking about security?
Yeah, I think that, and JD and Chris alluded to it in some of their RFP and kind of building their selection processes, but that's something that has come a long way with cloud, and we are obviously certified with all the ISO certifications that you would expect from a cloud provider as far as security. But at the end of the day, you need to dig in there because you're, I'll use the word outsourcing some of that to your vendor partners. So you need to make sure to understand that they're going to treat your data that they are going to house for you in the same way that you would, and the same levels of security and the same levels of service level agreements that internally your customers expect from you. You need to sit down with your business partner and better understand how they're going to help you take care of your data. So that's what I would say. It's about digging in and better understanding how far cloud security is and how secure it is now. And at the end of the day, it goes back to that scale, right? So you've got providers like Workday that are solely focused on taking care of security and taking care of that data, where you as a CIO are focused on keeping a provider operational and strategically moving that provider into the future and trying to balance several plates where security is just one of those. So at the end of the day, it's leveraging the scale of that business partner to drive extremely robust security in the cloud. So good question, Anthony. Thanks.
Very good. JD?
So, of course, one of the sayings in IT says the cloud is just somebody else's server. And so that's one thing to keep in mind. And I have a story to relay from another CIO who was using another vendor's cloud ERP, who shall remain nameless, and they noticed that their ERP vendor was not keeping the operating system patched appropriately, which obviously introduces major security challenges. So whichever commercial cloud that was sitting on was probably, super robust and secure and not likely to get hacked. But if the vendor that's providing the platform is not doing what they're supposed to be doing, then you always have to worry about that too. In terms of our experience with Workday, one thing to keep in mind is that what are the hackers really after? They're after a quick payday. And one way to do that is to try to do phishing attacks and get into your payroll system and change the banking information and get themselves paid. So we have Workday's been helping us with that. Actually, Workday caught something that they were in a position to catch, and we weren't. That was very helpful, and we've put some additional controls in now. We now have multi-factor authentication for anyone trying to get into Workday off of our network, and so those kind of things. So on the one hand, cloud introduces some different challenges and also introduces additional capabilities to deal with those challenges. So for example, we have the Microsoft multi-factor authentication, and there was a pre-built integration between Microsoft and Workday, so that was very easy to implement.
Very good. Chris, your thoughts?
Yeah, I have the same opinions as the others, the other comments, but I think a couple things that weren't talked about. The technology platform of an object-oriented architecture, which Workday sits on, from our perspective, that interacts with the underlying operating system in very complex ways, and we do not have the expertise to manage to put the protection around those types of interactions that Workday does. So under all of the due diligence that our other panelists have spoke to, we performed. But the overarching simplistic statement in that is we feel that the cloud-based vendors are best able to provide the security for their own platforms, and contractually, so that you don't have a blind trust, you have to build in the auditing links to make sure that, to JD's example, the operating system, that you're able to to audit and pick up those types of things. And we feel by doing that, that puts us in the best position. The other thing I do want to comment on, and JD gave an example of that, is just because you're in a cloud system doesn't mean that you're 100% protected. You still have to access that from your network. And for us, with all of these remote hosted and cloud-based systems, what we found very quickly is that we had to do a complete Active Directory redesign. And part of that was driven by security requirements that we needed to put in place to interact with these type of systems in the context of a single sign-on paradigm. So just because you go to the cloud doesn't mean that you have eliminated your own internal networking connectivity to the cloud piece of the equation. That still needs to be done. Very good.
Thank you, Chris. Wynn, let's start with you here. Talk about the cost issue. Should people think about moving to the ERP as a ERP to the cloud as a cost-reducing move?
Yeah, I think that obviously there are some balance sheet opportunities, I'll call them, when you're moving into cloud, operationalizing a lot of that spend and not having to invest in portions of the project significant capital. So there's an opportunity from there to free up some capital. At the same time, I think that there's an opportunity to evaluate, like JD and Chris alluded to, a lot of those legacy systems providers had to acquire bolt-on technology to fill gaps or lack of innovation in the product over time. So there's kind of a spaghetti diagram or a spider web of integrations and that cost money to maintain, and then third-party systems that you also have to maintain. So besides just the true technical moving to the cloud in the project, there's an opportunity to evaluate sunsetting third-party systems that the postmodern ERP technology in the cloud can now support for healthcare providers.
Very good. Chris?
Yeah, I think a couple of comments. There is definitely, at least in our, I guess what I'll start with is it's overall, it's a cost-neutral transaction. And providing a little bit more detail to that, given what I said before about our needing to modernize, for the short term, it's actually a little bit more operating expense because of the strategy we took with various maintenance contracts and support models on our other platforms. But in the long run, I think it'll be a cost-neutral transaction. It's a shift from capital to operating. In our world, that's an important shift, and that has ramifications that tactically you have to address, but strategically it kind of comes out in the wash. From a FTE perspective, we were able to shrink a couple FTEs, but in general, I'd say from an overall macro budget level, the same number of staff that we have are supporting both types of platforms. In the old platform, we had some database administrators. In our new platform, those FTEs now are taking on integrations responsibility. So we did not anticipate nor did plan for FTE decreases, and I know that's a big selling point of some of these pitches. So in a nutshell, I'd say it's a cost-neutral transaction that, because it's in a subscription model, we're able now to very easily put that into our budget at a year-over-year spend.
Very good. JD?
Yeah, so I guess exactly what Chris just said. I think there's pros and cons cost-wise, and it probably comes out to something close to a wash. And I was actually not at Dayton Children's in the early parts of the selection process where costs were being discussed, so I can't really comment on that.
All right, I just want to remind everyone to go ahead. If you have any questions, type them into the Q&A box, and we will get them in front of the panelists. All right, next question. Chris, You have, and we talked a little bit about remote hosted, you have your Cerner EMR remote hosted with that company, its own instance. How did that experience influence your decision to move your ERP to the cloud?
Yeah, so Cerner, in a nutshell, there, from my perspective, were two negatives that the Workday solution was able to answer. The first, from a remote hosting perspective, and this is my opinion, I don't know if this is shared in industry or not, but in my opinion, the way that Cerner performs its memory management for its platform almost makes it impossible to host locally. And we felt that because of that, we felt we needed to go to a remote hosted model. That shaped our thinking about other vendors. So the other thing that shaped our thinking was what we talked about before, is the amount of time and money it takes to upgrade a platform. In this example, Cerner, our old model. So those two biases kind of led to the thinking of the EMR or the ERP platform and what we need to do. So in that context, Workday answered the issue of the upgrades for us, and we talked about that earlier. And then I mentioned before on my other answer that we really do feel that the owner of the technology is best able to manage the infrastructure. So the Cerner experience, because of some bad things, kind of shaped our thinking to move to a cloud model. But in doing the analysis, we were able to come out of those initial biases with a strategy and relatively happy with the Workday cloud in terms of the time it takes to upgrade and the ability to continually be on the most modern technology for the platform.
Very good. All right, next question. I've read that going to the cloud is more than just taking something from here to there, but gives people an opportunity to reimagine process. Do you agree? And if so, can you talk a bit about this? JD?
So I mentioned Gartner's take on the postmodern ERP a few minutes ago, and that's pretty much what they're getting at here is don't just think about this as, well, now my ERP's in the cloud, but think about all the opportunities that brings to the table with integrations and how you can be more efficient with automating processes, and so that's definitely something that we are asking ourselves now. We had a strategy meeting a month ago, and we sat down and we went through some of that Gartner advice and asked ourselves questions about what that means for us and how we plug that into our existing plan moving forward with Workday.
Win?
Yeah, I think JD's spot on. You need to do the due diligence to make sure that it's not just a lift and shift of current state into the cloud. There's an opportunity to reevaluate your business processes. There's an opportunity to reevaluate the integrations that JD alluded to and make changes for the better strategically and operationally for your organization. So I think it's definitely something you need to spend some time doing throughout the project life cycle. So.
Thank you. Chris?
Yeah, I think JD in an earlier question spoke of a governance model, and in our context, we really used the Workday procurement to push redesigning all of our processes and workflows around finance, human resources, and supply chain. And to that end, a group of executive VPs and the VP and VPs constitute our change control board. And I found that very critical, because the workers, at least internally, that you rely on to configure the platform and provide the input they have day jobs, right? And they're so used to doing things a certain way and so used to evaluating risk in the context of the current process, it's very hard to get them to think about new processes. So we knew that, and we found it very beneficial to have the senior level people serving in the change control role. And that's what really drove the process. We worked off of a best model workflow provided by our implementation vendor and Workday. Workday was involved in that, and we did not deviate from that. And there were many instances when the teams tried, just because they were thinking about how things are, not how things could be, would try to deviate from that, and we had to stop that. So I completely agree with the question, which is, yes, this gave us a venue and an avenue to redevelop our process, and the main way that was successful in terms of the redevelopment was the level of executive with the decision-making authority to sit on the change control board. And we're actually keeping that same group together for a year to serve as the change control board until this kind of gets ingrained and we can change that thinking all the way up and down the line.
Very good. All right. Let's stick with you, Chris. And I think we're going to get close to the end here. What are some other ways that are coming down the pike for CIOs to reduce costs while increasing flexibility?
Yeah, I find us being able to maintain a cost-neutral position in terms of moving forward with our IT platform. So we have reduced costs in areas, but we found that there was a reason to spend the money in other areas. We could have taken that money and put it in the bank, but we're finding that any money that we save is being used to address other initiatives. So in the context of CIOs being able to reduce costs while increasing flexibility, our model for increasing flexibility is really to drive performance based on standard operating procedures for operations and for projects. And we found that doing that enables us to put in place a resource allocation model that allows us to maximize our flexibility. But that doesn't correlate into saved costs, because the more flexibility and time you have available, there's always work to do. And our governance process with our organization has always decided to reallocate those savings into other new work. So I don't know that we can say our budget looks smaller than it does before, but what we could say is our budget is now better enabled to meet the pressing needs on a 1 and 3 year basis.
Thank you for that. JD?
Yeah, very similar to what Chris said. I don't think we're really talking about the ability to lower the budget. We're talking about how do we get more flexibility and more capability. You always have the opportunity to retire some older, back in the day when we were doing cold fusion apps and, other goofy internal things that you can get rid of some of that. So a lot of times you're not saving big dollars, but you're getting rid of something. And so that's the goal. How do we make ourselves more agile, take advantage of all the capabilities in these platforms, eliminate some cost, but more importantly, really expand capabilities and the ease of our employees to focus on taking care of patients instead of worrying about their HR or finance issues.
Very good. All right, quick question for Wynn that I want to get to from the audience. How well does Workday work with Epic? Do you have many clients on Epic?
Yes, it's a good question. So work well with Epic. Obviously, it's bi-directional, right? So need to be able to be a source of master data and source of truth for item information and location information. And then get back from Epic demand signals, so whether that's supply consumption, bill only, or from case carts. And then at the end of the day, I think it's being able to bring in data. I think Chris and JD alluded to that at the beginning. Being able to bring in data from not only the operational areas, I'll say, that are transacted in Workday, but being able to bring in third-party clinical data from systems like Epic and Cerner, and then to kind of get a full picture of cost across the organization. So, we do have several customers who are using Epic and Workday now.
Very good. All right. That's about all we had time for today. When you close out your WebEx window, you're going to be taken to a post-event survey. If you could take a moment to answer that, we'd appreciate it. Regarding continuing education, those of you who hold the CHIME CHCIO certification get 1 CEU for attending our webinars. So let CHIME know you were here. And if you've asked us to do so, we certainly will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. You'll receive an email when our archive recording has been posted to our YouTube channel, and you can reach out to Nancy Wilcox if you'd like us to produce a webinar on the topic of your choice. Of course, you can go to our website to view our upcoming schedule. With that, I want to thank our panel, J.D. Whitlock, Chris Ghion, Wynn Fisher, and I want to thank Workday very much for facilitating and making this very informative event possible. Of course, I want to thank you, our attendees, for continually coming to our events. And with that, everybody have a wonderful day. Thank you.